Mr. Chairman, I'd like to review a discussion we had in our earlier meeting because I think it's helpful to put the spotlight on the issue, and it's the question of health care, which is the most significant part of the discussion about so-called entitlements. And I begin with the observation that we have very significant Medicare liabilities out into the future, but we also have very significant Medicaid liabilities that are going up. We have private health insurance whose costs are going up at least as fast, if not faster. It's a little hard to judge because they take away benefits to offset costs, but it appears to be going up faster in my view. You have the Veterans Administration and the defense budget both suffering from increasing in health care costs. Indeed, Secretary Gates said, healthcare costs are eating my budget alive, talking about the defense budget. When you stack all of those different elements of the American healthcare system together, we burn 18% of our gross domestic product on healthcare costs. Our nearest, our most inefficient, our least efficient industrialized competitor is at about 12%, which puts us 50% worse than the least efficient country in the world on healthcare delivery among our industrialized competitors, and very responsible views about what the savings are per year are as high as $1 trillion a year, which is a big deal for the economy. And sitting on this budget committee, I have the recurring frustration that there is a tendency to overlook the solution to that healthcare problem, which is actually very well underway in the private sector already in places like Geisinger and Gunderson Lutheran and Kaiser and Mayo and Intermountain and others, which is to quote my the ranking member, turn our system, our healthcare system, from one that is use this in a different context, but inefficient and wasteful to something that is healthy, lean, and productive. And because that's a cultural transformation, because it requires turning a few corners, because it requires an element, as Atul Gawande said, of experimentation and innovation, it's not something that lends itself to scoring. And scoring is always the coin of the realm in these budget discussions. Mm-hmm. So what I urged you in our off-the-record meeting, what I'd urge you again here today is that as you're discussing this problem, please don't overlook that element of a potential solution, which would not only help with Medicare and Medicaid costs into the future, but help with healthcare costs across the board, which are burdening our export industries, which are burdening our families, which are just a huge burden on the entire American economy. That's my worry. Because you can't score it, because it's a reform of a systemic nature, we tend not to talk about it. Simpson and Bowles came here. They agreed. Yep, absolutely critical. You're right, we didn't talk about it because you can't score it. Rivlin and Domenici came here. Yep, you're right, this is critically important. We didn't talk about it because you can't score it. Please don't let the Fed be a place in which this message gets lost simply because you can't score it. Chairman.
Well, Senator, I actually spoke about healthcare costs as a major factor in my testimony today, and I agree with everything you said. We have a system which is very excellent in some dimensions, is less than excellent in others, but certainly costs an awful lot. And finding ways to control those costs is absolutely essential, not just for the federal budget, although it's critical for the federal budget, but as you say, for the broader economy. And we've had a number of meetings at the Fed where we brought in health economists to talk to them about what the approaches are. And of course, there aren't any simple approaches, but I guess one principle I think, which might be set the stage for discussion is that one way of looking at our system today is we have a fee-for-service system and third-party pay. So there's really, in some sense, nobody who's making the economic decision about the effectiveness of care. And that's an essential element, I think, of an effective system. And there are many ways to address that, but that's one of the issues.
Thank you. I appreciate your coming in today. I know you have a hard stop at noon, and you're now 2 minutes over, so we will let you go. But
could I have 2 minutes more? Could you do that?
Absolutely.
I just would like to, if we could show on the screen some of the numbers I proposed. This goes back 2 administrations, but the numbers indicate that even though unemployment rate looks like it's moving down, and I think maybe that number on the right has moved up a little bit, we are still having fewer people working today than in 2001. And that is pretty significant since the population in the working age has increased. And I think all of us need to ask ourselves, how can we have more growth and productivity and job creation in that country? Would you agree?
Couldn't agree more.
And then the other chart is the labor participation rate, which is looking at the percentage of people in the working age cohort who are working. And that is a steady downward trend, and all of us need to be thinking about how to do that. I think one factor we've talked about is the debt. It may be having a crowding out, but if we can think of ways to increase productivity without increasing our debt, would you not agree that would be important? And if these trends continue, it would indicate that the United States is weakening as a nation economically.
Well, some of these trends are demographically related in one way or another, but clearly if we increase opportunity, more people will want to come back out of being out of the labor force and come back into employment.
And the unemployment rate is based on the number of people actually applying, but the number of people who dropped out is significant, and these figures show that. That number right there is considers the demographic and age factors. It says within the cohort of people that should be within the working age, we've got fewer working, and all of us need, both parties, I think, need to focus on that. I think it's one reason the middle class is feeling a lot of pain right now, in my own view.
Well, let's reflect on the fact that although there's a long way left to go, we have gone from an economy that was losing over 700,000 jobs a month when the administration took office to one that gained nearly 250,000 in the last report. So there's a lot left to do, but things seem to be we're adding jobs.
Well, I like adding some jobs.
Thank you.
But you have to add more than how many to actually gain on that chart right there. How many are added? Do you know offhand the number of people that are added to the cohort? And if you don't add at least that number of jobs, you're falling behind? The numbers.
Well, normally you need to grow at 2 to 2.5%, and somewhere around 100,000, 110,000 jobs a month just to keep it stable in terms of the unemployment rate.
So at least the last
we're
number
above
of
that.
240,000 keep us above that. Thank you very much, Chairman. We appreciate your testimony.
Thank you.